by the time you know what it is, one thing is that if you don't know your shape, when it is abnormal, you will not be able to identify it. Hello? If you don't know what it is, when it is normal, when something else grow, you will not take notes. So that is the purpose of this regular self-examination. So it's not that it will be bad. It's not that you are praying for bad. It's not that you are wishing yourself bad luck. No. So, but getting used to yourself, it is important. So by the time when you bath finish, you know raise your hand. Look at that. Look at the shape. You know what it is. So one day like that, if there is a lump there, it's going to make it shift or heavier than the other. So you are going to be suspected. That will call your attention. Why? Even the nipple, before you see, we call there is nipple traction, nipple retraction. It's one of the signs. You see the skin of the breast, the way it is. If it is used to be smooth and it's not now smooth again, it now look like that of orange. How many of us have seen orange before here? All of us now. Yes. You see the way orange is, as if you put needle, use needle to choke the orange, as if there is a small, tiny hole. Yes, the breast will be like that. Then you know that breast is something underneath. You know, one breast, you see that your breast is soft, everything. One is they are always down, and you now see all of a sudden, one is now look like stone, hub. The other one is now normal. They say, I thought it's normal. You see, many things they used to say. They say, I thought it's just normal. It's not. So, I will take this picture, I will try to show it around. I don't know if I have any assistant. What we are looking for, when you check, you are looking for a lump. Thank you, sir. When we check, we are looking for whether there is going to be a seed or whether there is going to be a skin changes. Any area of the skin is changing. It's not used to be one color before, but you are now having another different color, another area. That should call your attention to that, what is happening. Then you see redness. Then you see that the pull-in needle, nipple. It used to be normal before. Now this one is not different from the other one. That should call your attention to it. The dimple, that's what I explained about the orange body. Then we're talking about dripping. You know, when it's discharging, if anybody is not breastfeeding and the breast is bringing out milk, it's not good. And some people, it will not be just ordinary milk, it may even be bloody something that is coming out. If it's somebody that is looking for a baby, it may be the reason why they are having delay. You are not pregnant and you are not nursing a baby and your breast is bringing out milk or any whitish discharge. Your period will not be regular. And you have to seek medical attention. So what I was saying, I was talking about when you want to do it, as you are looking at the mirror, when you divide it into two, use this right hand to examine the left breast. Right hand to the left breast. You put the hand like this, pop of the hand, you have already divided it into four. Then you are putting it, you are checking. If there is a seed there, it will come under your hand. After you check that corner finish, to the one inside, you check it. The one under again, you check that one. Then you check the one outer. Then the center is the one you check last. So if you check it today, you know how it used to be. You do this one to the other one. If by chance there is a seed there, you will know, no, I don't used to feed this thing there. It's heavy, it's paining me, it's doing something. You used to know. And by that, you can go to your doctor and you can even get to do a scan, which will identify, okay, there is a. So most time, if you notice it on time and you go and remove it, after you remove it, there is a test you are going to do on it. We call it histology. That will show whether it is just a mere growth or is a cancerous growth. So once you do it and it clear you, it's a mere growth, your mind come to rest. There is no issue. You know that I have a patient, thank God our own is not cancer true, but he has that growth, but he's afraid. He just think it's not there, Joe. But the day she went with a friend and the mother or the auntie of that friend died of a cancer, and they went for the burial and all those stuff, he came to me to come and say, doctor, I want to have this thing removed. And that's the only why he got it removed. Thank God we will do tests, it's not cancer. But you know that I have another bitter and a very sad experience with one of a patient of a blessed memory now. It's a small lump that he saw and he come. They said, madam, we will remove this thing. Your bill is 100,000. They now say, no, okay, I will go and come back. He now went to general. They now start in one of the hospitals, I don't even know, maybe gone to wherever. They now start taking, okay, today, tomorrow, come, whatever. As she was on it, the thing was growing. It was growing. All of a sudden, she developed hypertension. We cannot do the surgery again, no. Your BP is high. Go and meet those one that will control the BP. When the BP control, come, we will now do it. Before you see it, the whole breast is fungating. It's fungating. Until you get to a stage that they cannot even touch it again. And the woman later died. It's not good. And again, it's better it does not happen than when it happens, it's expensive to manage. I won't lie to you. From the surgery is not when it becomes a full-blown cancer, surgery is not the only management. You have to do the surgery. After the surgery, when you heal finished, you have to do tests. The tests are expensive. After you do the test finished, then you have to now go for the chemotherapy. That one is now the money. But anybody that can now get through all those things, it can be conquered. It can be overcome. Are you getting me? But the issue there is that we are not even talking about that journey. We are saying discover it on time. Get rid of it before it gets rid of the person. That's what we are talking about. When you check regularly, you'll be able to identify it. Please. Thank you, sir. Yes. Our time is fast point. Yes. So if it is identified when it is still small, the treatment is cheap and it is easy, and it also can prevent death. Getting regular screening tests is the most reliable way to find breast cancer early. There's no other way to it. That's the only way. Now, I've said the other time about the cervical cancer and endometrial cancer that women should report any unusual discharge. Spotting means you are seeing blood. You are no more menstruating, but you are now seeing blood. Somebody that has passed the age of menstruation, and all of a sudden, the period that has stopped like 3-5 years, you now start seeing some unusual blood like that. Please see your doctor. Are you getting me? So, on an unusual discharge, this one is not like the Agboola, the white one, whatever. Just very watery and you go and you just come and so you have to report to your doctor of vaginal bleeding that is getting worse, occurring between period or happening after menopause, to a health care practitioner. So we should try and do that. Cervical cancer, I've talked about it. For the adults, those ones that already married and all those stuff, there is what we talk about, HPV. I say chronic infection by certain type of human papilloma virus. That's what we call HPV. Is the most important risk for cervical cancer. I spoke about it the other time. Human papilloma virus. And you can get HPV through intimate skin-to-skin contact. Such as having vaginal, anal, or oral sex with someone who has the virus. Other risk factors for cervical cancer include smoking, having a weakened immune system, having and having a chlamydia infections, being overweight, being exposed to or taking certain hormone treatments. I told you the other time that using some stuff to shrink fibroid, they were thinking they are killing a demon and creating a worse demon. They thought they are killing one demon before, but they are in the process create another demon. So those are the things. And another thing, having regular cervical cancer screening test is important. I told you that every girl or a teenage girl should have vaccination against human papilloma virus. It was HPV virus. They give them, and it's about 2 or 3 doses. Once they take it, they are covered, and that is important. Now, what is the take-home point to prevent cancers? Stay away from tobacco. There are 2 different smokers, the active smoker and the passive smoker. You are not smoking, but on the table you are sitting, there are 3 or 4 smokers there. As they are giving to you, left, right, and back, you are just taking it in as they hot. Are you getting me? You end up smoking more than each of them. So tobacco smoking, you have to get away from it. Get to and stay at a healthy weight. Be careful about getting overweight. Get moving with regular physical activities. Follow a healthy eating pattern that include plenty of fruits, vegetables, and a whole grain. Fresh and natural stuff can be of good help. And that limit or avoid red and or processed meats and highly processed food. I've mentioned all those ones. All those highly processed food, we should run away from them. It is best not to drink alcohol. If you do drink, have no more than 1 drink per day for women. It's best to avoid it, but when you do, don't take more than 1 per day. Protect your skin. This is another thing for women. Please be careful. I've not seen those bleaches ones among us, but some use creams and their skins become very, very tiny, thin. Anything can happen. We work in the hospitals. There are many scenarios of this. Women that wake up early in the morning, they are going to maybe a market to go and buy early in the morning. All those markets, you have to go early in the morning when the people from the village are bringing those stuff, and they have accidents. When they were going that early morning, they will not see road very well. It's still dark, and the woman had cuts here. I could not even get a skin to even suture. The skin is just like nylon. There is no how the wound will break down. The skin has its own function, so the wound break down. You spend money, dress, and all those, and the scar will be very big. So it's really, really an issue for her. Imagine you should have maintained a black and all those stuff with a better healthy skin. It's good, and it will be more better for her. So please, we have to really take good care of our body. When we say our body, our skin is inclusive. Please. And final one, know yourself, your family history, and your risk. Praise the Lord. This one is very simple. Know yourself, your family history, and your risk. It is simple, but it is very, very deep. We Africa, we don't used to know our family history. Many of us say, my daddy, I don't even know what killed my daddy. I don't even know. I just get there, they say he has died. The next thing is that how we are going to buy the amala and whatever that he will do is to do. You are not concerned. Then again, if you are sibling, imagine, we have not talked about hypertension. Hypertension is another thing. that really affect a lot. And we are going to check many BP today. You know, and his family history is important. If your mother is hypertensive or your father is hypertensive, that means you have a chance, likely slight higher in risk of having it. But many do not even check. Many will even see it like this. They will not even check. Even if there is a pharmacy or a clinic around you, you will not even check. Even let your husband even have hypertension and is even checking and have the machine, you will still not check. Why? Now so now, you know, in hospital we used to see a lot. The person we admit that is sick, that because of the BP, that Baba you cannot go home, or Mama you cannot go home, or your BP is high. Are you getting me? And we are saying we are treating. Now there is somebody that will come and see the mama. I want to check this mama that is sick here. Mama Jayi that you admit. Where is he? Okay. After he greets Mama, please. Doctor, please tell your girl to help me check my own too. Joko, come by and check here. By the time you check, you say, Baba, your own are 250, 120. It's even higher than the one you come and see. You cannot go. Doctor, Oba one more sorrow. You see now, we see it a lot. Walking corpse. Their own is even worse than the patient they come and even see. But they don't used to check. They don't used to. So, and you know one thing is that family, if you have younger ones or elderly one, we don't have that free discussion that I say, Auntie, Egboba would set a knee for Pagi, manga, and only ope. You are bro Jago. So don't wish me bad luck. Only yabi. Attention. We cannot even relate. Uncle, if you see the people, the Caucasians, you see them, they know the history, their family history. They will tell you, I'm here, doctor, to check my this I do every 6 months, every 1 year, because you see, my uncle died of this, my grandfather was died of so, my clinical have so, I don't have this thing, and doctor have told me the other time that I have a clinical of this, my chance of doing this is increased. They help you even as a physician. You love them. They make the work easy. But we don't know. We don't know. If you see your sister call like this, you say, oh Male, you too, if you call another person, you don't even want to reveal ourselves to ourselves. So, Africa, we hide a lot of things. We die within ourselves. We are lone rangers most times. We don't talk, we don't share. And you know what they say, that a problem that is shared is half solved. So what are we talking about is that we all have to cultivate the habits of medical checkup. Our health is, that's where I started from. When you check it, and I said prevention is what is cheaper and also what easier, very cheap and easy to manage. So I don't know if we have any questions, anything to ask. Oh, yes, ma'am.
Good afternoon. Sir, you are highly welcome. We welcome you. I would like us to go back to pap smear, because I'm one of the people who are doing pap smear for almost 10 years now. It's very good. It's very healthy for the woman. But here in Nigeria, I don't know, I'm not criticizing, but it seems like they are not taking pap smear serious. It's really helping, especially with your vagina, your womb. It's helping you a lot when it comes to your private part and the other things. Please just go deeper about it. Explain to them about the pap smear. What is pap smear? How is it going to help them? How is it going to prevent all those kinds? Please go deeper. Let them understand the pap smear.
Thank you. Do we have any other questions?
Thank you for the teaching so far. I have about 1, 2, 3, 4, 5 questions. My first question is, you talked about family planning. I want to ask, is there any side effects on family planning? That is the first question. The second one is, there is this saying I do, said as a married woman, a breast that is not being massaged or sucked by the husband may lead to breast cancer. I want to know how true is that. The third question is, what are the causes of ectopic pregnancy? What can lead to ectopic pregnancy when, as a woman, you are experiencing such a thing, so that we can work towards that? And what can cause thyroid gland? Thyroid gland. What are the things that can cause thyroid gland? And the excess salt in the body, what is the implication of excess salt in the body? Thank you.
Do we have any other questions? After that third one, I will now answer. Okay, mommy too. Okay, no, somebody's. Oh yeah, give it to me. After her.
Praise the Lord.
Yes.
You talked about teenagers taking the vaccine. Is it only teenagers? At this age, we are all adults. Can we adults take the vaccine as a preventive cure? I don't know
Thank
if
you.
it's...
Yeah, we answer. Give it to mommy. After that, I will now respond. Then we have another set.
Thank you, doctor. I want to ask, if someone is having a occasionally sharp pain on the breast, it will come and go like that.
Okay. Thank you. All right. Family planning. There is nothing in this life that does not have side effect. Water. Does water not have side effects? Tí omi bá pààyàn lórí, if you aspirate water, is it not water that you will still drink? That's not good. That does not suit you itself. Let me even hit the nail on the head. And the side effect is that maybe your period will not come. Or your period will not come. Or you have it in excess. Or maybe your tummy is getting bigger or those stuff. And those one come out with injectable type. Remove it. Get an implant. If it's the implant is disturbing you, remove it. Get a copper T in an insertion. Are you getting me? So there are so many other stuff you could do. That answered that. We ask another questions. It's too much salt. Too much salt. It's not good. Excess salt in the body will lead to hypertension. That's just it. If anybody is hypertensive, he has to reduce salt intake. Salt in your body will make you osmotic effects. Are you getting me? That's science. Go to osmotic effects. Osmotic effects of it. It will make you to retain water. And water will increase the pressure in your blood. It will increase the volume of your blood. And it leads to hypertension. And it will affect the heart. Heart failure, all those stuff. So, excess salt is not good. Everybody, all the mothers here on your dining table, there must not be salt. While you put sugar, your water, your bonfita, your everything on your dining table, salt must be missing. Even now, sugar should not be there. So that daddy, when daddy is eating, you will not be tempted that let me put salt. It's not enough. So it is a bad habit. When you have you just eat that one like that. If the salt is not enough in that soup, just manage it. By the time you say you are adding, that one will not dissolve. You will be taking more than you ought to take. It's not good. Somebody talk about the pap smear. No, it's because of time I didn't go deeper. And that's not only one thing we can talk about pap smear alone. But one thing is this: what is pap smear? Is the service. We are talking about the service. How do they do the test? They are not taking you, they are not biting you, they are not cutting you. It's just a scraping. They just take a scrape of the service and they do a test on it. You know, and if the service is having some, it's just like we are doing skin scraping test that the dermatologist does. Just scrape your skin, all the dermas and all those stuff, and they carry a test on it. Are you getting, if it is getting changes or necessary change or atypical changes, they will tell you. And there are many steps from there. If you need to do anything, they take it up from there. You know, there are many diagnosis centers that does it. Clinics is there and some other stuff like that. Go and meet your doctor, they'll get it done. Women, once in a year at least. It's only when the first result is not good. That's when you have to do it every 6 months. But if it is negative and all those stuff, maybe once in a year or so, it's okay. And for mommy that said, what about adults? It's only young ladies that need to take those vaccines. It's because majority of the sexually active already may have the virus in their body. And once you have it, the vaccine is not effective again. So what is now effective now is the pap smear. You cannot see us prescribing pap smear for a teenager, for a young adult. It's only the matured one that has to do pap smear. And mommy said about occasional breast pain. Now, there could be many things that could cause breast pain. One of the commoner things is that it comes periodically with your cycle. There's always some changes that happen with a cycle. And if it's only pain, and you know one thing is that under the breast, there is this muscle of the chest that women have. You also have your own. And after, under the muscle, is our rib. And this rib, you know that is like a curve, like a ring. There is a way it joins. So if you walk, depending on the activities you do, you may have those inflammation of those joints, which may make you to feel pain under your breast. You know, the breast is sitting on top of those stuff. So that could be, so you need to see your doctor. And if it is too persistent, you may have to have a scan done. And if you are above 40 years, your doctor may have to ask you to do what we call mammogram, which is what will help us to check the breast, at least the earliest screening. If there is anything atypical in the breast, we will be able to pick it out. I don't think I miss anything out. Thyroid gland, causes of thyroid gland. All right. Majority of the things that cause thyroid gland is when we consume salt that does not have iodine. You know, iodine deficiency is one of the commonest things that results in goiter. Goiter is thyroid gland enlargement. All of us have thyroid gland. Any person that does not have thyroid gland will not be feeling fine. Are you getting me? All of us have. But some people can be bigger. So if there is iron deficiency, and you can see that the government have done well, and they have been able to phase out all these measured salts in the market. You know, the sensitization has gone so wide that even the mothers now, they don't go for the cheap measured salt anymore. You get the one that are being packaged. But only God now knows that whether those packages now have been infiltrated and they now take the measured one and now repackage it for us. So that one, we don't know that Nigeria we did. But we know that Mr. Chef and all those stuff are really iodized shots. Though they are expensive more than the stuff, just because they did it very well. And that's why we encourage everybody to take that. And you know, those are the things. Any other question? I hope I do justice to all the questions.
Yeah.
Yeah, yes. So any other person? Sir, give.
Good afternoon, everyone.
Yes.
And I'm aware that they said there are some kind of foods that you eat that will increase the chances of having cancer, like sugary food, carbohydrates. I want to know how true is that. And number two, when someone is cancerous and you are not aware, how do you know? Do you feel pain, or how will you be able to know that you are cancerous? Is it painful?
Thank you. Sir.
Praise God.
Yes, sir. Yes.
It's about the food we eat. I read an article on the consumption of wheat And the article was trying to say that wheat is even more loaded with sugar than the regular sugar that we eat. And that why some people, or why we say that, oh, wheat is light, is good for diabetic people, is more or less like increasing the symptoms even until they die. That now we are depending more on the wheat because of the basic ingredient in wheat, and it's more of, so I don't know, I just read the article. I want to see how true that is, and what would be the alternative to that, whether we should stop. If a bar is carbohydrate, everything is carbohydrate, and wheat is also, what then are we eating?
All right. Nobody is cancerous. Now, what happened is that there is always a starting point in every disease condition. I hope we are all together. Sorry, ma. But the most dangerous aspect of it is that majority of the onsets are always without sign. We call it asymptomatic, without symptoms. So then, majority of times, when the symptoms are coming, it's something we can easily neglect. That is one thing. Another thing about us is that our health-seeking behavior. Health-seeking behavior, that is one thing. We don't seek health. We don't check up. One thing is this. Anybody that is 40 years supposed to have a thorough medical checkup once a year. If you are between 60 and 70, you should do it twice a year. If you are 70 and above, you should do it every 4 months. Now, how many people does that? You see? And that is one thing. And if you want to enter an hospital now, like now, if my patient come, doctor, I want to have a complete checkup. I will look at you and say, what do you say? Are you sure you really want to have? It must be loaded. How much do you have in your hand to have? What am I saying is that it's expensive. It's expensive. And insurance does not cover it. Are you getting me? So that is it. Our health insurance is still not, we are still not there. We are not there. And health is really expensive. But one thing is this, and that is the basis of this gathering. What do you do? How can you increase your suspicions? How can you be at alert? We say, if it is breast, check it like this, like this, like this. So that when you see anything that is like seed, you can easily know and go to, doctor, I have this seed there. Too, when you are going to doctor, be careful too. I've seen somebody that when he identified the thing, the woman did well. He know that this is a seed. But he went to a doctor. The doctor said, Madam, is a nothing. Just don't worry. It cannot disturb you. He will have taken it out. Until the thing, I know when you believe your doctor now, it's just doctor like pastor or lawyer. There is nothing, they go. The thing is getting bigger. The woman said, the doctor has said there is nothing. Are you getting me? So that is another thing. If you are still not satisfied, it doesn't mean you should stay with one doctor. Seek another person. Get until you satisfy with whatever thing they are telling you. That is one thing. The other thing is this. We talk about some signs. Just when you are conversant, when you know yourself that when you shit, you don't used to poo blood. And all of a sudden, you are seeing blood in your stool. You should seek explanation. You know that you used to see period once in 28 days or once in 4 weeks or whatever. Now it's in between that period. You are seeing some spotting, some blood. What's this? Where is it from? Are you getting me? You know that you have stopped these things. This thing has stopped. You are not seeing period again. All of a sudden, you now see spotting. You are getting it. You should seek explanation. finding. That's how you can know. And I told you that unexplained weight loss is not good. Something you have to seek what is causing it and be fine. And daddy that asked about the wheat. Well, wheat is also a form of carbohydrates. And what is in carbohydrate? Carbohydrates they are varieties. And there are a lot of the sugars. We have fructose, we have glucose, we have lactose, and all those stuff like that. Glucose is the one that is the sugars most that really affects all this sugar that we are talking about. Some other one, lactose and all those stuff, they are not too bad like that. And the glucose ones is majority of the food, like the starch now, all of them like that. One thing is that all of them, almost our food, they are that carbohydrates. And that's when we are talking about, moderation is the key. Moderation is the key. Moderation is the key. Once you eat, let there be moderation. If you drink, let there be moderation. And if anybody is diabetes, or if anybody has a risk of diabetes, maybe the father is diabetic, you have to be very careful. It's the feeding habits that will teach that son or that daughter too to be diabetes. It's not that time you have to be taking, okay, let's talk about this. You see Coca-Cola, all these soft drinks, you say they are sweet. That's how all of us know that they have sugar inside. What about beer? Which one has most? The beer. But beer is bitter now. Beer is bitter now. The sugar in beer is like times 2 of those one in Coca-Cola. Yes, where you cannot even take, because it is sweet in your mouth. If you take too much, you say it's okay, I don't overdo. If you take 2 bottles of water, you say it's okay. But there are some men, they will sit down with crate of 12 of whatever, and they will do that one. And they will just go and be getting, as long as you provide a place for them to eat themselves. And they will continue. So one thing is that it's just moderations. And for the diabetes, there are some food actually that does not really affect like that. Or they are, when you see this one have this effect of like this, and this one have this effect of like this, it's just better instead of going like this, just stay with this one. And one thing about diabetes is this: one, it is also controlled, depend on the level. If you see, I have some of my patients that are well controlled. They eat. They can even eat pounded yam. They can eat all this, but I will tell them, if you want to eat your pounded yam, eat it in the morning or in the afternoon. And the size of your feast is what you are eating. And that's all. If you want to get to a party, you are controlled. Don't worry. Daddy, you can freestyle this week, this month. We are good. You get to any party, any occasions. If you are sharing malt, take. You may not even finish it. They know, and they also have the strategy. Malt, they put malt. They fill it with the cup with half. They add water to the remaining one. The cup is filled up. And they are sipping it. Everybody is doing it. They will not say daddy is not even taking. Why is everybody taking drink and daddy is only taking bottled water? What is he doing? Are you getting me? I have some also men too that are so okay. Because you can still do like your friend, but you have your limits. Behind you in your mind, you know what we are dealing with. Then this time everything is controlled, but you can do freestyle. You can hit. You can hit yam, but not that time. When we have not controlled, we have to streamline. Everything has to be controlled. Everything. But when we get to a level, they have to, and that's what we are hearing. All our food, rice, eba. Just don't let us even be naming them. Just take cassava, yam, and grains. That is all our food. Are you getting all those spaghetti? They are processed. They are grains too. Are you getting me? All of them are carbohydrates. So yam, all those. So you have to be careful. And many of us, all of us, we can sit down with 1 tuber of yam and finish it. And this yam is sweet, bring 4, bring 4. You cut 1 tuber and you finish it. It's not good. The whole of the thought to sugar in your body. It's not good. When rice, no matter how sweet the yam is, when you choose 3 slices, it's okay. Do we have any other questions, any clarifications? Oh yeah. So after that, we just quickly do the checkup and see what it is.
Sorry, sir. Please,
Yes.
most of us don't know the kind of food that contain fiber and alkaline, because I learned that alkaline food and fiber are more better than those carbohydrates. So we want to know some of the samples of
When
alkaline
you
and
talk about
fiber.
fiber, you're talking about your beans, talking about your fruits, vegetables. You know, vegetables, they go from your ewedu to your okra, cucumber, cabbage, garden egg, and your green leaves, all of them, oha, all of them like that, like that, like that, like that. So they are those ones that helps. So the other ones are like that. We don't talk about, you know, when the age comes, even though now there are some fishes now that we cannot be talking about fish. Fish is better than meat. And when you talk about meat, there are two different types of meat. There are red meat and the other one white meat, like your goat meat, and the cow meat is the red meat. And you talk about your limit. When you eat chicken, for elderly ones, the chicken is much better, and let them remove the skin of the chicken. You know, the fat in the chicken is loaded, almost all the animals. The fat is loaded under their skin. So remove the skin and the rest is also good. Are we getting me now? So those are the things. Any other questions? Yeah, mommy.
Ẹ jọ̀ọ́ sà o, àwa gẹ́gẹ́ bí àgbàlagbà, ǹjẹ́ ó ní irú oúnjẹ tí a gbọ́dọ̀ máa jẹ tó máa fokun sí ara wa ní stage tá a wà?
Bẹ́ẹ̀ ni mà, ó ṣe pàtàkì. Omi làkọ́kọ́ ọ̀rẹ́ yín, then èso. Àwọn èso tí a ti sọ nípa wọn yìí, watermelon, bó ṣe apple ni, bó ṣe ọsàn, bó ṣe ọ̀gẹ̀dẹ̀. Tó bá ti jẹ́ àgbàlagbà tí kò ní ìtọ̀ ṣúgà, ó lè jẹ ọ̀gẹ̀dẹ̀, ó lè jẹ èso. Eléyìí tí ó bá ti wà ní sísìn, òun ni ó dáa, bó ṣe àgbálùmọ́ ni, bó ṣe mángòrò, bó ṣe àwọn oríṣiríṣi bẹ́ẹ̀ 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 lọ. Dẹ̀ níwọ̀ntúnwọ̀nsì, ẹ̀fọ́ ó dáa fún ara, bó ṣe lá, bó ṣe ewédú, bó ṣe ẹ̀fọ́ ìgbàgbá àbí ẹ̀fọ́ ṣọ̀kọ̀, oríṣiríṣi ni àwọn ẹ̀fọ́ yẹn tó wà, so wọ́n dára. So then àwọn oúnjẹ wa náà ta oúnjẹ, èmi ni ẹ̀wà, èmi ni àmàlà, èmi ni sẹ̀mó, gbogbo wọn náà ló wà òkè. Ṣùgbọ́n nǹkan tá à ń sọ ni pé níwọ̀ntúnwọ̀nsì tó oúnjẹ wa bá ti wà balance, tí a ní àmàlà, tí a dẹ̀ ṣe ọbẹ̀ tó dáa sí, tí a dẹ̀ fi protein sínú ẹ̀, bó ṣe ẹja, bó ṣe ẹran tó ṣe kíní sí, ó ti dáa. Yes. So we are talking about somebody saying what used to cause ectopic pregnancy. No, there is something I close eyes about. It's about toilet infection. What everybody talk toilet infections. No, women's bodies are open. They are not like men. Men, we get to toilet like this, we will throw our tata pot. We will not move closer to it. But women cannot do like that. And by that, they are being exposed. And that, they get those infections. Vaginal discharge, burning sensation while urinating, all these things, soreness, discomfort and all those stuff, inflamed and all those stuff, swollen skin around vagina, vulva itching, and purulent and copious discharge and all those stuff, greenish, whitish, brownish or cream color, and painful urination, pain during intercourse, vaginal bleeding and all those stuff. That can come about it. And now, there are things they should not do, women should not do. You know, douching. I know all of women, we know what is called douching. We know putting hand inside and washing with soap and all those perfume and all those stuff is not good. It's not good. And there are some drugs or cream women do for all sorts of things, vaginal tightening cream and all those stuff. We should not do them. They are not good. And what really causes ectopic pregnancy at times? Infection can cause what we call PID, pelvic inflammatory disease. You know, it has to be, when you have it, you have to be treated. People thought, they will always say, I treated infection last month, I treated it 2 months ago. No, you don't do it properly. Once you do it finish, do you do another confirmatory check whether it has gone or the treatment has completely eradicated it? You know, if you kill it from here to here and you didn't finish it up, after the drug finish, this one too will come up again. That's when you see that after like a month or two, your symptoms also return. when you have feel some kind of relief initially. So those are the things that comes, you know. I hope I've done justice to all these questions. Please, oh yeah, let's have a check. Let's do the check.